DHA had for Abu Dhabi, OMSB for Pearson View, that is Oman Medical Specialty Board, SPLE, Saudi Pharmacy, MOH, Prometric, Qatar, Kuwait, NHR. So, team, if there is any difficulty in seeing my presentation, please inform me as soon as possible. Now, I
Yeah,
hope
ma'am,
all of
sure.
you can see my screen. Okay. Actually, I was not aware of that. I'm sorry for that. So, shall I move to the next slide?
Yes, ma'am.
Okay, okay. So regarding DHA domains, I have told there is slight pattern change. So syllabus remains same, but only some sort of pattern change is there from April 2023. So basic thing you have to focus is never to by heart the concepts. So earlier you could have studied everything from many materials available, readily available materials, question bank materials. So these days they are checking the quality of the employees. So as a result, you have to be thorough with the very basic concepts of pharmacology. That is the most easiest way to crack this examination these days. So DHA different domains are there. You can see basic biomedical science, pharmaceutical sciences, then comes social, behavioral, administrative sciences, and clinical sciences. Mainly four domains there, and you have to get 60 percentage of pass mark in each domain. And you can see here, I have given a brief picturization about the score distributions, but it actually depends on the set of examination papers which you are receiving. Many times it won't adhere to the exact percentage that we describe here. So every time personally, I recommend all of you to be good with the concepts of pharmacological subjects rather than depending on the actual percentage distribution of these domains. So toxicology you have to cover, that is mainly antidotes of medications, even snake poisoning. Such questions will be trending these days. Then gestation and lactation related topics, gestation, different FDA categories there, category A, B, C, D, X, different categories. And in lactation, which all medications are safe in lactating mothers. Then comes to pediatrics, pediatric dose calculations, very important. You might be knowing, you are familiar with a different wide variety of calculations. Geriatric population. So once you're considering geriatric population, so you have to avoid polypharmacy. You will be getting a lot of case scenario questions related to geriatric population. So in the upcoming slides, I will make you understand how much significant is each population in each case studies. And pharmacy calculation and compounding, that is also very important. Then pharmacokinetics, pharmacodynamic related topics, the pharmaceutical care and disease state management, like public health related topics, medication safety, and it will be including with kind of storage of medication, stability, etc. Then OTC medications, over counter medications, and pharmacy law and ethics. So, and dear participants, don't mistaken it as pharmacy law and ethics, which we follow in India. Not at all. Indian rules and regulations. We follow US FDA protocols, US Food and Drug Administration regulations, and most of the GCC countries, they will be following SFDA regulations, that is Saudi Food and Drug Administration regulations. And regarding the Oman examination, Pearson View examination, there is updated syllabus for 2023. So it includes uh, participants. You have to understand that the basic thing is that even there is some updation in syllabus. The earlier syllabus is also having same topics as of updated one. Only things slight change in score distributions, etc. Pharmacotherapeutics, it consists of 30 percentage, then 10 percentage consists of pharmacy practice, quality, safety, pharmaceutical sciences, ethics, regulation, and professionalism. Again, never go with Indian laws. Research and evidence. I have seen many of my candidates, they are being thorough with Indian laws, Indian schedules. We should not follow Indian schedules for GCC examination. You will not be having such questions related to Indian laws. And regarding pharmacy technician, so your role in abroad countries is entirely different from Indian scenario. So always you have to focus with the professional ethics and whatever happens in the pharmacy uh, platforms, not like in Indian drugstore system, not like OTC systems that we widely use in India. So you have to go more with your uh, kind of ethics, regulations, professionalism that you have to maintain in foreign countries. And research evidence-based practice, you will be having 5% questions. Public health and health outcome like tuberculosis or like prevention of tuberculosis, like public health related topics. Communication skills, this is very important. So as you all know, like pharmacy technicians even play a major role in a foreign country pharmacies. So what you have to do is you must be thorough with the basic communication skill notes, whichever you get, you have to go through that different kinds of communication skills you have to go through, so that you have to prevent medication error. Many strategies, prevention strategies are there that you have to focus, especially for pharmacy technicians. You will be getting logical based questions like pharmacy environment related questions, whereas for clinical pharmacist and pharmacist, they will be asking you questions from clinical pharmacy case study related questions. But for technicians, you have to go with the very basics. And the last topic for updated domain syllabus will be pharmacy management and administration. So, like different kinds of PTC, pharmacy therapeutic committee, you may be knowing different ethical committees. So, everything is covered under this 5%. That's about Oman syllabus. And regarding Saudi pharmacist licensure examination, you will be having again four domains like that of DHA, biomedical science, pharmaceutical science, social behavioral administrative science, as well as clinical science. So I'm just giving you a picturization on what is the difference between the syllabus of different examinations, since many candidates are asking me a question, repeatedly asking me a question, which examination is easy. Actually, like till April 2023, DHA examination was very easy. I have already mentioned you. You could have studied that copy paste same question bank question scenarios, but now it is not the scenario. You have to go with the very basic things. So regarding basic biomedical sciences, I hope all of you are aware of anatomy, physiology. You might have studied in your first year courses. So I'm excluding pharmacy technicians from these portions because for technicians, you are getting very logical kind of questions. I have already told you, like community pharmacy, hospital pharmacy related questions you will be getting. And also you will be getting 25 to 30 percentage of pharmacology questions for technicians. So this is for mainly for a pharmacist as well as clinical pharmacist. You will be getting anatomy related questions like your major body systems, biochemistry related questions. You will be getting protein, lipid, carbohydrate. I hope all of you know about a Krebs cycle, citric acid cycle. These all are commonly asked questions. And enzyme related, enzyme kinetics and cell chemistry, signal transduction pathways, DNA, RNA related, genetic related questions. These days, trending questions, pharmacogenomic questions are very much trending, like phenytoin, if you are using in a specific genetic mutation patient, what happens? Such questions are trending these days. And regarding microbiology related, you will be getting more kind of microorganism related questions like gram staining, positive, negative gram staining. And recent exam, they had asked a question like on microscopic examination, it was found to have grape cluster like formation on microscopic structure. So you have to identify which bacteria it is. Such questions are common these days. And pathogenic microorganisms of humans, causative organism, for example, a causative organism of diphtheria, like that questions you can expect, causative organisms. Even brucellosis is it bacterial infection, viral infection. Actually, brucellosis is a bacterial infection that is transmitted by cattle via uncontaminated via contaminated milk products, etc. And immunology related, this is very, very important portion. Innate adaptive immunity, even immunization is very important, which are the birth vaccinations, and even which are the vaccinations safe in immunocompromised malignancy patients, vaccination safer in gestational woman, like that questions you can expect for your exam. Immunization and principles of antibody actions, you may be getting question related to antibodies like immunoglobulin E, G, wide variety of immunoglobulins, their functions, locations, everything you could be expected for exam. And hypersensitivity reactions, I hope all of you know different types of hypersensitivity reactions there, type 1, 2, 3, 4. So if you're by hiding all things, very, very difficult. So for hypersensitivity and all, you can keep some mnemonics in your mind, like acid. I have framed a mnemonic: acid. A for type 1 allergic, acid. A stands for allergic. C for cytotoxic. I for immune mediator. D for delayed reaction, like that. Acid cod you can remember and study. Hypersensitivity reactions. Then genetic related, I have already mentioned. Genomic related questions you can expect in biomedical science domain. And related to pharmaceutical sciences, you can expect medicinal chemistry. So this is a nightmare for most of these days students. So I have already told you DHA pattern change from 2023 April. So I understand that most of the questions, medicinal chemistry questions, will be like 10 to 15 percentage question only, organic chemistry, medicinal chemistry related questions, specifying structure. So for the past many months they were not asking repeated questions. So soon after September, they are asking again repeated structure questions like mefenamic acid. They may be giving you a question, which of the following, they will be giving you one structure and they will be asking you, you have to identify the structure. And these days, even if you don't study medicinal chemistry structures too properly, if you are not too thorough, it's not possible to study all structures, A to Z structures. So if you are thorough with pharmacology, okay, if you are having the basic knowledge, the most important thing you have to go first is the beginning of your coaching. What you have to do is you must be thorough with the medications. If you get one drug, for example, if you see a drug like felbamate, you must be able to understand, or you must be able to identify for what condition it is used. That is indication, main indication of the drug you have to focus on. Because if you're going with chemicals classification, I'm not telling you study phenytoin, hydantoin, chemical classification. If you even not thorough with the chemical classification, at least the least thing you should know is the basic indication of particular drug. If you see felbamate, you must understand, you must identify it as anti-epileptic drug. So here I can give you one example for medicinal chemistry question. If you are thorough with pharmacology, basic pharmacology, these days medicinal chemistry question also you can score, even if you are not much familiar with structures also. I'm not telling no need to study structure, you have to, but there is limitation, all can understand. So regarding medicinal chemistry question, for example, you will be getting one structure they may be giving like mefenamic acid structure, and the question will be like, which of the following drug can be used to treat dysmenorrhea? That is a trending repeated question these days for DHA examination. So if you know, in the options they may give like ibuprofen, naprox, and different medications they may be giving. So if you know the use of mefenamic acid, the most widely used action, if you know, you can easily score that question, even if you are not too thorough with the structure too. And also one more thing I can tell us related to the medicinal chemistry structures, like CCB, you might be knowing calcium channel blockers used as antihypertensive. So we have dihydropyridines and non-dihydropyridines. So related to dihydropyridines, if you know the basic structure, no need to study amlodipine, nifedipine, everything separately. It's not possible. So if you know dihydropyridine basic structure, somehow you can identify the drug from particular options. And pharmacology, toxicology, very, very important portion. This is the core subject you should love for your exam. You should study pharmacology. You cannot skip. Majority of the scorers, like winners, they can easily crack examination if you are good with pharmacology basics. And pharmacognosy and dietary supplements. These days, they are asking you questions like a drag and drop test for which alkaloids you are doing this drag and drop test. Like that, different alkaloid related questions you will get, like ginger. Ginger, it's having anti-emetic property. What is the property? Or you may getting a different palm so like that some leaf is there recently. That was an unexpected question. Like kind of palm leaf, so which is used in BPH treatment. What is that? What is the mechanism of such palm so leaf? And even these days, they are asking you questions like herbal tea. What is the interaction of herbal tea with warfarin? Is there any interaction? Or garlic? What are the other unapproved FDA indications for garlic? Like the dietary supplement questions also these days trending. Ginkgo biloba use, kava kava use, etc. Then pharmaceutics and biopharmaceutics, and for the last 1 year, they were rarely asking Sutex question in some examination set of papers. Even no kind of Sutex question was there. But these days, again, for the past few months, they have again reintroduced Sutex questions. So that is why I'm telling you, always don't go with the syllabus. Don't depend entirely on the syllabus. You must cover all these portions, but more safe zone is to be thorough with pharmacology. Sutics and all you will be getting like different dosage form questions, etc. And biopharmaceutics questions will be there. Kinetics related, simple, repeated questions you can expect. Even washout period elimination, how you can calculate. Half-life, how can you calculate such questions. Then pharmacokinetics related questions. Then sterile and non-sterile compounding. So sterile and non-sterile compounding, I could say, it's the core important portion for technician, pharmacy, assistant examination. Sterile, non-sterile preparations, very important. And for pharmacist examination, even for clinical pharmacist examination also, they are asking a few questions related to this, like different types of ISO class 5, class 8, then laminar flow hood, HEPA filters, such questions you can expect. For pharmacy technician, this is the core portion you have to focus on, sterile and non-sterile preparations. And related to social behavioral administrative science, you have to go with public health. This and all some kind of story questions. Even if you get on the spot itself, you can answer basic kind of questions. And organization of healthcare delivery systems, for example, like IP, inpatient drug distribution system, you must be aware of what is unit dose system, 24-hour only 20, single dose delivery system. Such basic things you must be aware of, despite of clinical pharmacist whomever it is. And related to public health and wellness, you have to go with chronic disease prevention, health promotion, infectious disease control. You may be getting questions related to TPN, total parenteral nutrition. So TPN administration set and rule, you have to change every 24 hours to avoid sepsis, catheter related sepsis, since TPN is a large volume parenteral. So such infectious disease questions, how can you prevent such questions? You can expect for example some nosocomial infections, hospital device related infections, how can you prevent? Or you may be getting questions like, you have seen some visible particles in some IV parenteral preparation. So options will be like some funny, even confusing, like you can just take it out with your fingers and use it, reuse it, like that questions and all you can expect. For technicians, all answers, you only thing you have to know is better understand the question well from your own side, and you have to answer logically. Very logically, technicians can easily crack the examination. And population-based pharmacoepidemiology related questions you can expect, especially study design kind of questions. What is cohort? What is case control? What is difference between cohort case control? What is cross-sectional study? Sometimes they will give you a question like there is a journal published and it consists of information, case study on a single patient. He had some drug, vancomycin induced Redman syndrome, like that rare disease conditions or adverse reactions. So if it is a single patient, you must know it is case report. If it is multiple patient, case series means multiple case report is case series. So you must understand the very basics rather than by hearting. And these days they are asking you about risk ratio, odds ratio. So many are good with the formulas, equations. They are thorough with equations. So recently one of my candidate had a question that was related to prevalence and incidence. So in that it was telling a pharmaceutical manufacturer had made a and they have manufactured a new anti-cancer medication, and survival of the patient prolonged, improved. So if you know what is prevalence, what is incidence in exact manner only, you can answer that question, because here the patient still had cancer and the survival rate only improved. Patient still had cancer. So that means here no incidence. Incidence means newly diagnosed conditions are incidence. Prevalence means newly or existing, whatever it is. Whatever conditions are there, that comes under prevalence. So here in this question, even though the newly discovered medication has improved survival rate, since patient has cancer till now, you can choose answer like prevalence rate is increasing. So cancer patient is still there. So you cannot choose incidence as the option. You have to choose with prevalence. So that's why I'm telling before by hearting, you may be getting different materials available for by hearting, all kind of formulas and everything that has no use. Apart from that, you must understand what is the difference between so and so incidence, prevalence, whatever it is. And data sources and analytical tools like different kind of biostatistic tools are there, SPS and all. So like that, rare questions also you can expect for exam. Then application of epidemiological study designs. So RCT, randomized control trials, they are experimental interventional studies, quite expensive, but you can use for vaccine trials, etc. So such applications are also important for exam. And some kind of pharmacovigilance questions you may get. So pharmacovigilance, it belongs to the last phase of clinical trials, post-marketing surveillance. You must know what is the definition of vigilance and epidemiology. So I'm not telling you study all these definitions like theorem, not like that. So you must understand. If they are asking you question like ADA monitoring, you don't answer it's pharmacoepidemiology, because both sound same. I have many candidates still they are answering pharmacoepidemiology means monitoring of adverse reactions, not like that. So epidemiology, epidemic means a kind of disease. You must know such basic terms. What is the difference between endemic, pandemic, etc. And medication recall, regarding medication safety, medication recall and all different classes, class 1, 2, 3, 4 classes there. Class 1 recall means you are with manufacturer is withdrawing the drug from market due to serious adverse reactions, fatal, deadly reactions. So drug is withdrawn from market. That comes under class 1. And pharmacoeconomic related question, definitely you can expect these days. Pharmacoeconomic analysis, you know, CMA, CEA, cost minimization analysis, cost utility analysis, different kind of pharmacoeconomic analysis there. So cost minimization analysis means this is the simplest pharmacoeconomic analysis. Recently for MOH examination, they had asked a question like, which is the most simplest pharmacoeconomic analysis. So answer would be cost minimization analysis. So if you have two therapeutically equivalent drugs, pharmaceutically equivalent, therapeutically equivalent, so just cost comparison, you will go for the cheapest drug, because drug A $5, drug B $10. If both drugs are therapeutically equivalent, definitely you will go with the cheapest drug, no? So that is cost minimization analysis. That would be the simplest study. And then comes with pharmacy practice management. So what is planning, what is organizing, directing, controlling pharmacy resources? You may get such questions. And inventory related questions you can expect for pharmacy practice management domain. Even accounting, budgeting, financial year, what is fiscal year? So financial year is fiscal year. So such terms, financial related questions also will be asked. For even for clinical pharmacists, such questions will be asked. And next comes with the pharmacy law and regulatory affairs. So you have to go with different authorities like Food and Drug Administration, DEA, Drug Enforcement Administration. So that will be controlling schedules. especially class 2 scheduled drugs, narcotic medication. So as per Drug Enforcement Administration, how many years, which is the minimum year you have to keep your narcotic prescriptions documents, such questions you can expect for exam. And please don't study intent laws. There will be no use for your exam. And biostatistics and research design. This I have already explained in previous slide. Then ethical decision making. So apart from all those subjects, medicinal chemistry, statistics, psychology, clinical pharmacy, so ethical principle questions you can expect for all three candidates like clinical pharmacist, and even technician, because professional ethics it's very important. You should even apply this for your case study analysis questions. Some biomedical ethics you have to follow. If any patient is refusing surgery or something, you cannot force patient. You can, in the options they will give you, force the patient to have surgery. You cannot force the patient. Such ethical principles you have to follow, like beneficence, you have to do good for others, for good for the patients. Non-maleficence, that is no harm principle. You should not harm the patient. Recently one of my technician student had a question, same question you can expect for even clinical pharmacist. No such limitations for such questions. Ethical questions applied for all sections actually. So one of my recent technician student had a question. A pharmacy In pharmacy, one patient came with a prescription of isotretinoin, and patient was on gestation, so and so month, some trimester was mentioned. So the technician has dispensed the medication. So it violates which ethical principle is asking. So they are violating non-maleficence. Non-harm principle is violated here. Such questions you can expect for exam. And even you have to maintain confidentiality. So recently one of my pharmacist candidate had a question that hospital CEO was the relative of some patient. So how can you handle with the confidentiality data? So even if relative or something, unless until permitted by patient, you should not disclose patient information to others. So such options might be confusing. You may feel which option to choose. They may be giving you twisting options. So using your logics by proper practice, you can answer those questions. And professional communication. And one more thing I have to tell is please be good with your basic medical abbreviations. If you see BSA, you must know its body surface area. If you see MTX, you must understand that is drug methotrexate. Always don't expect they will not give you the expansion. They are not going to give you whole expansion. You must understand such basic things. And related to professional communication, verbal, non-verbal, visual, written, maybe you will be getting question like literate patient or illiterate. So such answers you have to find accordingly. And principles of communication abilities with other healthcare providers. So you have to use can you use rude tone or smooth tone? Such questions also will be there. Very easy to catch up the options, but options will be confusing, bit twisting. And related to social behavioral aspects of pharmacy practice, you will be getting many questions related to, for COVID, what was the transmission route, or a recent exam one question was there. Winter is approaching, a elder woman. She is afraid of winter related respiratory infection. So what should you do? Uh, should she wear mask, or should she have vitamin C supplements like that? Prevention, disease prevention related questions you can expect. Then medication dispensing and distribution system. So types of distributions. These days, you may get questions related to pharmacy automation, automated dispensing cabinet related questions, barcoding system questions, and all you can expect. Then systems for safe and effective preparation dispensing of medication. That is, which are the methods you can prevent medication error. So if you have sound alike, look alike medications, how can you prevent error? You have to use Tallman letter. I hope all of you are familiar with Tallman letters. That is, you have to use uppercase and lowercase letters, like prednisone, prednisolone. Both are sound alike medication. So pretny you have to use with small case letters, lower case letters, whereas that son and solon, like sound alike terms, were like letters, you have to highlight with uppercase letters. That is Stallman letters. And role of automation and technology. So I have already told you these days trending question, barcode scanning. What is barcode scanning in pharmacy drug distribution dispensing system? Such automation, robotic system, such questions you can expect. And continuous quality improvement programs, protocols in medication use, identifying medication errors, like risk analysis. What is risk analysis? Which are the risk analysis category? Such questions also you can expect. And related to clinical sciences, you will be getting drug information related questions like suppose a clinical pharmacist having doubts regarding some medication dose. So how will the drug be dispensed? Is with can you continue guessing the medication or something or not? So drug information resource, primary, secondary, tertiary, different resources available. They may give you PubMed, which resource you have to identify. Such questions also you can expect for exam. And clinical kinetics, pharmacokinetic questions, disease prevention questions, patient assessment. So these days they may be asking you what is palpitation, what is auscultation, patient assessment related questions, what is icterus, such questions you can expect. And clinical pharmacology, therapeutic decision making. Such pharmacology related questions also you can expect. So and so disease conditions there for patient, like patient is African Caribbean population. So which antihypertensive can cause more adverse reactions? So CCBs, if you are giving in African populations, adverse reactions will be worse. And so such decision making related, therapeutic decision making related questions based on populations also can be expected for exam. And here, what I have to tell you is you have to study smarter. So, as per recent trends of examinations, no more kind of by-hearted swallowing questions. Don't depend just mugging up those questions and vomiting on the sheets. Not like that. You have to study smarter. Not that harder, but you have to study smarter. You must know what you should study and what you should not focus. And I can give you some tips regarding that. So many may be having some difficulty in remembering, recollecting all those adverse reactions and everything, but you can go with some kind of mnemonics. Mnemonics very much useful. Is even for phenytoin, you can go with mnemonics. See, valproate, I have found here one mnemonic. V for vomiting, A for alopecia is hair loss, L for liver toxicity. Valproate, if you see such question, hepatotoxic patient, you have to contraindicate valproate use. Valproate can severely cause severe hepatotoxicity, liver toxicity. Pancreatitis, pancytopenia, that is all blood count will be lowered. Pancytopenia, pan means all. So see here, you can see pancytopenia. In some exam papers, you can see they will ask you, any doubts, anyone having to ask? Something to ask? Shall I continue? Okay. So pancytopenia in exams, you may get direct questions also. Okay, sometimes they may ask you direct questions. What is pancytopenia? So penia means you must understand it is a law count. Something is law, that is law count, that is penia. If you see emia, if any medical term ending with emia, you must understand emia means something related to blood. Pancytopenia, here penia means law count, so law level of all blood counts. Uh, I kindly request you to mute because I can hear a lot of background noise here. Is there anything to ask? No. So R is for retention of fat. So fat retention can lead to weight gain, even or for edema, peripheral edema. Then anorexia for anorexia, that is loss of appetite. T for tremor. E enzyme inhibitor. Valproate, it's an enzyme inhibitor. So you must know enzyme inhibition means metabolic drug metabolism will be inhibited. So whichever drugs you are giving, co-administering along with valproate, since valproate is enzyme inhibitor, all other drugs, co-administered drugs, metabolism decreases. Once drug metabolism decreases, it will not excrete out, it will be accumulated and it can lead to toxicity. And see, corticosteroids also I have framed here one mnemonic, corticosteroid and all adverse reactions, very, very important for exam. Most probably they'll ask you questions like how corticosteroids affect blood sugar level in particular patient or something. So you can see here it will be increasing, blood sugar level will be increasing. See, diabetes, D for diabetes mellitus, increases, hyperglycemia it can go. So C for Cushing syndrome or osteoporosis. So corticosteroids, if you are on long-term therapy of corticosteroids, you should have vitamin D and calcium supplementation to prevent osteoporosis, especially in elders. R for growth retardation, T, thin skin, I, immunosuppression. So you may be getting super infections, recurrent infections. C, cataract, glaucoma, or edema. S, suppression of HPA axis. T, teratogenicity. E, emotional disturbance. R, hypertension, rise in BP or obesity, eye increased hair growth, hirsutism, hair growth may occurs. So that is with corticosteroids. If you are good with such mnemonics, if you can remember such mnemonics, that will be very much beneficial for exam because some classifications and all very confusing like which are the examples for penicillinase resistant penicillin, acid resistant penicillin, or short acting statins. Short acting statins you have to administer at night because cholesterol synthesis is peak at night. So you have to give such statins at night, especially short acting statins. So you have to study some mnemonics for such confusing classifications. See, for essential amino acids, many are having doubts. They may be asking, most probably they won't ask non-essential, like 21 total amino acids there. So essential amino acids, if you're studying, you can go with this mnemonic. I love Lucy very much. Please try to help arginine. So if you're good with such, if you can at least remember, recollect these uh, mnemonics, at least some minimal kind of mnemonics, it will be very much helpful for exam. If they are asking which of the following is an essential amino acid except. So many candidates will be ignoring the word except, E-X-C-E-P-T. Except means excluding. Always you have to read the question thoroughly because at the end of question they may give except. You might not be expecting that word. So never ignore. You read the whole question because some questions you will long lengthy question case scenario question will be there majority 80 percentage lengthy case scenario questions may be there, so especially for DHA examination these days. So if you see such question, don't assume like they are asking which is the best choice. So in the at the end of question they may be asking which is the poor choice, which is the least favorable choice. So read the question properly always. And regarding case study scenario, you should have that skill to analyze case scenario questions. It's something different different from all other sections of questions. Case study scenario, you have to analyze it properly. And it's actually a piece of cake, I can tell, because it's very, very easy once you understand how to do the analysis. Case study scenario questions will be easy. So first of all, what you have to do is once you get a case scenario question, don't be panic. If you see a lengthy question, don't be panic. Even for calculations, you may get lengthy question. Don't be panic. If you read the question carefully and if you understand, that will be easy. That will be easy to find the solution. Read the case thoroughly. First of all, you read thoroughly. And I can say many candidates always, if you see some question related to Parkinsonism, without reading the third sentence, in third sentence, they may be telling patient is psychiatric patient or something. So maybe some contraindication there. But most of them, Parkinsonism, they say they choose levodopa without a second thought. Always read the case scenario carefully. Medication history is very important. Case history, like patient history is very important. History of DVT, deep vein thrombosis, or anything, history of cardiac disease. So for example, if I'm telling If you get a question for diabetes mellitus patient, and if you see option like pioglitazone, don't jump into glitazone thinking it's anti-diabetic or let me choose that as the answer. Not like that. In that question, somewhere may be hidden like patient had history of MI or something. So glitazones, pioglitazone, rosiglitazone, they are thiazolidones categories. So they will be causing ADR like edema, weight gain, fluid retention, mainly cause fluid retention. So fluid retention means it can exacerbate or worsen heart failure. So you have to contraindicate its use in MI history patients. So don't choose such answers. That's why I'm telling never rush into a case study. Seeing one disease condition, not like that. Don't assume the answer. Don't guess the answer. You have to go with the population, even geriatric, like a child in pediatric population, geriatric population. You avoid multiple polypharmacy. You better avoid. You choose if any monotherapy that would be better. So age is very important, even gender is very important, I can tell you, because question may be there regarding phenytoin, some woman, Mr. Mrs. XY or someone, she's having epilepsy, so you are administering patient with phenytoin for past few months, and patient currently experiencing hirsutism. So those who don't know what is hirsutism, you will be stuck with that question. Hirsutism means you must know. I told you, you should know the basic medical terms. Hirsutism means increased facial hair growth. So, since it's a female patient, she complains of increased facial hair growth due to phenytoin. Question will be like, as a pharmacist or CP, what is your intervention? So, should you switch therapy or should you continue therapy? Like that question will be there. So, female population means they cannot tolerate that ADR. Increased hair growth means they cannot tolerate. So you have to switch therapy or discontinue therapy. Depends on the options. But if male population, if same question like Mr. XY, he had hirsutism means you can tolerate that ADR, male population. So you continue therapy. So here, what it signifies is it's very important to note down even the gender. Never ignore even a gender in the case study question. Yes. Is there anything to ask? So you have to take patient's age also into consideration. You have to know the patient's age. So if it is a child, you have to lower the dose in children. You have to opt such options. Even for children, you cannot use aspirin, tetracycline. Those medications are contraindicated. Even for older patients also, you must be aware of many side effects. You have to opt answers accordingly. If any CNS effects, drowsiness, dizziness causing medications, you have to avoid it in such older patients. And if any patient having a risk of like any kind of infections, or if they had some history of bleeding or something, and if you are using warfarin, you must be very cautious in judgmental with the options. Age and onset of biological change also important, because if you get a question related to female patients having menopausal women, bisphosphonates, you can start with that patients, because bisphosphonates will be the preferred agents for postmenopausal osteoporosis. Such questions you can answer accordingly. And related to elder patient geriatrics, when comes with metabolism also, the renal function might have been decreased. So metabolism, drug metabolism rate also decreases in elder patients. It can cause increased adverse effect profile. So you must be very cautious in opting options, especially for geriatric population. It should not harm the patient, should not cause toxic effects. Such an option only you have to choose. And their medical history also important. So you can see here one example, older patient admitted to hospital with bacterial infection. So few years ago, patient had DVT, deep vein thrombosis. So now the patient should be considered with anticoagulant therapy, because already it's elder patient means DVT risk increases. Already patient has history of DVT, and see admitted patients or maybe chance of immobilization, no movement for many days. So these all can increase risk of DVT. So definitely you have to suggest anticoagulation therapy. So you have to opt up options accordingly. And you have to go with the proper diagnostic parameters also. So here you can see some examples: sodium, potassium, WBC, cholesterol ranges. So basic thing these days trending, one of the trending topic these days is you have to go with lab values. I'm not telling you by heart all these lab values, not like that. If you see LDL, that is low density lipoprotein, bad cholesterol. If you see such question, if you get a value, you should must know what is the therapeutic goal. That is LDL lower level must be low below normal level must be less than 100 mg per dl, or if any patient having hypercholesterolemia with multiple risk factors, your target LDL level will be less than 130 mg per dl, like that. Points you have to remember. I'm not telling you by heart all these things, not like that. If you see serum creatinine as 2.7 mg per dl for some patient, you must be able to identify it's a higher value. What is the normal range you must identify. And some other diagnostic parameters also important. For example, I can tell I recently had seen a case scenario question, and that option Holter monitoring was given. So if you have no idea about Holter monitor, actually Holter monitor is a portable ECG. It's used only in case of extreme scenarios you are using. If it's not actually a primary therapy, it's not at all a primary remedy. You will only go it with extreme scenarios of heart patients, severe arrhythmia conditions, and all. If patient having symptoms like giddiness, fainting, you can go with Holter monitor. Otherwise, it's not a primary line of therapy. So such basic knowledge you must gain by proper reading. You have to read a lot. And here you can see PPI, proton pump inhibitors, pantoprazole, you are usually using very commonly prescribed medication. So PPI, if you are using, it will definitely reduce your gastric acid levels. And if you get a question like about ketoconazole, case scenario question, with ketoconazole is antifungal medication. So with ketoconazole, you should not prescribe or you should not administer PPI, because ketoconazole means it need a good acidic environment for proper absorption. If you are giving PPI, it will suppress acid. Again, ketoconazole absorption will be impaired. So, such things, such general, very common drug-drug interactions and all, you must be aware of. And you have to know side effects, drug interactions. So I have already told you, like drug interactions. If you get a question like nitrates, a case scenario question, patient have hypertension, diabetes, patient is taking nitrates for some angina conditions or something. And in the same question, they are giving you a patient recently diagnosed with BPH, benign prostatic hyperplasia. So in the options, they may give, I'm talking about a recent exam question. So in the options, they were given sildenafil and some other phosphodiesterase inhibitors. So you cannot choose any phosphodiesterase 5 inhibitors. PD5 inhibitors you cannot choose, because you know nitrates and PD5 inhibitors can cause severe hypotension. So the last option was no pharmacotherapy. So that one you have to choose. Now you may be surprised why no pharmacotherapy, because no other choice. Actually, your answer must not be based on the whole question. Your answer also depends on the options which you get. So in that, you cannot choose any options. A, B, C options were of phosphodiesterase 5 inhibitors. No, PD5 inhibitors are safe with nitrates. So you cannot administer. So you have to go with the last option. No other choice. And the basic thing you have to go is you have to practice, practice, practice. There is no other alternative for case study analysis. And I can give you one example here. This is a 62-year-old female patient. She had hyperlipidemia, hypothyroidism. She was prescribed with cholestyramine, levothyroxine. What advice would you give the patient to avoid drug interaction between cholestyramine and levothyroxine? So many may be thinking like option A, you can choose. Yes, stop taking levothyroxine as it can interact with cholestyramine. So you have to understand a fact. Yes, you can stop levothyroxine, then it is very easy. Cholestyramine will be having no kind of interaction. But you have to understand same thing. Levothyroxine was given for hypothyroidism. Like hyperlipidemia, hypothyroidism is also a condition you have to treat. It cannot be left untreated. So option A you cannot choose. Then next option will be taking levothyroxine with gap. That can be correct, because levothyroxine you have to have empty stomach even with plain water, because if you take with the tea, coffee, milk may interact with levothyroxine. So you cannot give levothyroxine with milk or coffee or something, only with plain water. And switching to cholestyramine or to colsevelam or colstipol, that won't act, because cholestyramine, it's bile acid sequestration. Anyway, it is sequestering agent, complex binding agent, colsavelam, colstipol, colstearamine, all these belongs to bile acid sequestrant, same class drugs. So you cannot switch. That's not the remedy. It will not eliminate reaction. So you have to go with option B. So you can see here, colstearamine, bile acid sequestrants, they can bind with several medications. So levothyroxine absorption may decrease. So the best option you can choose is administering levothyroxine 1 hour before or 4 to 6 hours after colstamine, just keeping a gap. And team, for case scenario questions, don't expect the same answer. You cannot expect for like straight away you don't expect the options. You have to eliminate wrong answers, like I have done here. Option A, you have to eliminate option A, option C, option D. So once you eliminate all the options which is again retained, that would be the correct answer. For case scenario questions, don't expect the exact answer. No one is going to get the exact answer. You have to eliminate the wrong answer first of all. So you can see next question. Elderly female. She lives in farmhouse. She was taken to emergency department. She had ingested some liquid from unlabeled bottle, and she had some kind of suicide attempt. She was presented with diarrhea, frequent urination, convulsions, pupil constriction, excessive salivation. You can see body secretions increased. So see the option. She most likely consumed organophosphate pesticide. So those who know organophosphates means they are cholinergic, indirectly acting cholinergic agents. So all cholinergic agents means secretions will be increased. If you know that very basic point, cholinergics, all cholinergic agents increase your body secretions. If you know that simple point, basic point, you can easily crack this question. So option A will be the answer because it's kind of cholinergic crisis. That's why increased secretions. And the symptoms consistent with sympathetic activation. No way. Sympathetic adrenergic is something different. Her symptoms treated with anticholinesterase agent. Her symptoms treated using cholinergic agonist. We are not talking about here any treatment. First, you have to identify. Patient had suicide attempt, so you have to identify what was that unlabeled bottle. So you can uh, choose option A as the appropriate choice because symptoms are consistent with cholinergic crisis and all those secretions, increased secretions, it can depict patient had organophosphate pesticide poisoning. And coming to calculations, about calculations, the basic thing you have to go with. Many candidates are telling they are not having basics with calculations. That's fine, but you must be good with cross multiplication. The basic thing you have to know is cross multiplication. Then comes few equations. Even if you don't recollect equations, there are ways, many questions where you can directly apply cross multiplication. You cannot ignore cross multiplications. Conversions, you must know 1 grain, how many mg, 1 teaspoon, how many ml, 1 pint, how many ml, 1 cc, how many ml, 1 quart, how many ml. Such conversions you must know. 1 kg, how many pound, because some questions pound, kg, conversions needed. You cannot mix up units. And in questions, you have to go for the hint. Sometimes they may give concentration is 5 mg per 100 ml, like that you may get. So you have to go with such hint to start the steps. And unfortunately, in exam, they are not providing any rough papers or pen, pencil for calculations, written calculations, but desktop calculators will be provided. What you have to do is basic thing. You have to do every problems stepwise. Then after a few practices, it will automatically get into your mind for mind calculations. You cannot make any blind guess with numericals. You have to read the question. You have to understand purpose of question. Simply, if you see 500 ml, don't assume you multiply or do something. Don't make such assumptions. You have to understand purpose of question and some basic etiquettes you have to follow, like you cannot mix up units. 1 mg and 1 kg, so 1 mg and 1 gram you cannot put in same question and do. You have to convert it as per the requirements. And for calculations, you have to understand medication labels and equipment used in measuring doses, like which all equipments are used in measuring, like for especially for dilution purpose and all. And dose calculations important, especially pediatric dose calculations and all. Then quantity calculations important, dose calculations based on volume of distribution and amount of drug, etc. Then percentage problem solving is there. You have to find percentage, like before dilution, after dilution, what is the final strength? Such questions. IV flow rate, dosage form equations, infusion time calculation, how many drops per minute, like that questions. Alligation method, it's a very traditional method. It's bit complex, bit lengthy, but very simple. If you go with some table, a tabular method, if it will be easy. So you may be getting question like, suppose prescription order contains 80 percentage medication, but unfortunately it's not available in pharmacy or hospital. So you have to use high concentration stock solution, whatever available in pharmacy, lowest concentration stock solution, whatever available in your pharmacy. So once you combine it, you will be going with alligation method. So as to get the prescription strength. Then dilution, direct formulas available. Clearance also formula, direct formula available. Viability. So all these are dilution, clearance, viability. All these are trending question these days. You have to go with direct equations. You can do it directly. And uh, most of you know, most of the pharmacy examination, if you guess the answer, for wrong answers there is no negative marking. You can make guessing, but you must know one thing. You have to analyze yourself. Are you a risk taker or a good guesser? If you are a good guesser, it's easy to score. There will be no negative marking. And you have to learn to use the process of elimination. So simply option A, B, C, D, you cannot eliminate. You must have thorough knowledge. If you know what is the reason behind option B, C, D, if you know something related to B, C, D options, then only you can eliminate it, and finally you can come with option A as answer. So if you read some question bank, question 1, answer B, like that, if you study, no use. Whenever you are studying any question, you must know why other options are not included as the answer. That is the basic thing you have to do. You can see here a question. Which of the following are examples of aminoglycoside antibiotic? Except is the most ignored word by the candidates. Except means excluding. So all are aminoglycosides. So if you know tobramycin, neomycin, streptomycin, mycin ending drugs, if any candidate who has not thoroughly revised pharmacology, they may be thinking clindamycin, mycin. This is also aminoglycoside antibiotic. They may think this question had some error. Actually, if you are properly thorough with clindamycin classification, pharmacology, then you can identify clindamycin. Even though clindamycin has exception. Clindamycin, it belongs to lincosamide antibiotic. So if you are thorough with some basic pharmacology classifications, only you can go with the correct answer. Otherwise, such tricky questions you can definitely expect for X. And some common brand names which are available in GCC countries. For most of the technicians, you will be facing such questions. They may be giving you simple question. Option may be easy, very easy options. Question may be easy. Only thing, the candidate is not able to understand what is, not able to identify brand. Xanax. Xanax, you must know it's alprazolam, benzodiazepine, and Valium, diazepam, it's benzodiazepine. So question may be easy, option may be easy. If you don't know Valium, then you will be troubled. So some basic common brand names you have to be thorough. Allegra, Atarax, hydroxyzine, all these you must be aware of. That's why I'm telling, if you know even Allegra, fexofenadine, if you know without indication, if you have no idea about fexofenadine, what is this? At least you must know it's an antihistamine. If you have good memory power, I could tell you study. It's a second generation antihistamine. It's non-sedating. Second generation you can classify under non-sedating. Hydroxyzine, first generation, sedating. SAH, in exam they may give you SAH. Don't be stuck, what is SAH? Don't wonder. SAH means sedating antihistamine. Such basic things, basic abbreviations and all, if you know, you can easily score the exam. And the thing most of the candidates are panic about is recent days is about medicinal chemistry. So medicinal chemistry also, I told you some Prometrics. And see, yeah, this is about a penicillin general structure. You can see four-membered beta-lactam ring. Beta-lactam ring. It is attached to thiazolidine ring, and see R group. Group is there, alkyl or whatever group is. So this R substitution will it determine the drug stability to enzymatic degradation or whatever it is. And these R substitution even affects antibacterial spectrum, whether having any anti-pseudomonal action or a gram negative, gram positive, whatever action. So if you know the basic thing, if you at least know beta lactam ring, it will be easy for you to understand. For example, you can just understand at least it is a penicillin. Just go with this basics, beta lactam ring. And that is about our sessions. Is there anyone having something to ask? Is there anything to ask? This is question answer session. Is there anything to be asked?
Ma'am, from where we can get the question bank of previous year paper or something like? Is it a good idea to go through it?
Which exam are you planning for? Danish?
Ma'am,
Danish? Yeah.
DHA, Dubai Health
Yeah,
Authority.
yes, yes. For DHA examinations, these days we don't prefer much question bank. So, first of all, the thing is you have to go with the very basics of pharmacology. Okay, like a few years ago, till 2023, like April, you could have gone with question bank. If you were lucky, there were many students. They were getting same question, same options. But these days, that is not the scenario. First of all, you have to go with the general syllabus thoroughly with the theory concepts, basic concepts. Then, if you go with some question banks, you can just use it as a practice material, not solely question bank. Don't please depend on question bank alone. It's very difficult to go with the examination. Okay.
Ma'am, how to be strong in the beginning stages of pharmacology or the
Yes,
basic of
yes.
the pharmacology?
Yes, yes, that is a good question because most of the candidates they are having huge career gap or something like that. And the thing is, the basic thing with pharmacology, you have to go with the classifications. I told no, if you see a drug like lacosamide, you must be able to know at least. Just ignore the chemical classification. If you cannot go with chemical classification first, just leave it. But you must know lacosamide is anti-epileptic. Its indication is epilepsy. If you know that basic thing, why I'm telling, if you get a case scenario question or something, there will be some hint hidden there so that it will lead you to correct answer. Somehow you can use your logical reasoning skills to answer that question. If you have no idea about a particular drug and you are only depending question bank, no, there is no use with that. First of all, basic thing is you have to be thorough to identify a drug. Just plain identification of a medication. Is it clear, Bharat?
Yes, ma'am. Thank you, ma'am.
Yeah, yeah. Okay, thank you. Any more questions?
Thank you, ma'am. Thank you for your tips and tricks for
Yeah.
the cracking of
Okay.
exam.
Yeah.
Your
Yes.
mnemonics were helpful for us. Thank you, ma'am.
Thank you. Thank you so much for the valuable feedback. So if you are having any doubts or you have to contact me, please reach to me via LinkedIn, and I can also even share my running YouTube channel link also. You can just contact the team also, the administration team also, if you have to reach to me. Okay. Thank you. Thank you, all of you. I hope no more
Thank you, ma'am.
questions.
Thank you for joining with us in Sikand,
Thank
ma'am.
you.